welcome back to Open Forum, ladies and gentlemen. 103.5 FM, humradio.com. And, it's a pretty bad-looking day outside out there.
What did you bring it to Houston?
I have not brought anything to Houston, dude. I live in Houston, in Sugar Land. But, it was supposed to be cold, so it's cold.
It's cold.
What do you say? It's supposed to be cold.
It's cold.
I would be mad if they said it was supposed to be sunny, but it's cold today.
Cold and rainy.
And dreary, yeah. Well, but in the studio, it's really hot out here.
Yeah, absolutely.
We have a really hot topic here today. In the studio, 103.5 FM, I want to thank our partners, Indo-American Chamber of Commerce of Greater Houston.
Absolutely.
We bring this hour once every month. It's called the Business Hour. And in this, we discuss businesses, basically. And we have our chamber that's been our partner for about 3 years now.
Maybe more.
Maybe more.
Right.
Actually, they want to say forever, but I think
Right.
it's fine.
Yeah.
It is finite. It's
Actually, even though they were not partners with it, they were still supporting us.
they definitely were.
So
And-
in that sense, they were partners from the beginning.
Yeah, so we've had, on behalf of the Chamber of Commerce, various corporations here. Today, we are indeed proud and really happy to have St. Luke's CHI in the studio with us. And so we're going to go, this is like a first name basis out here, right? Mm-hmm. My name is Subodh, this is Jagat, this is Darshak, and I have Natasha outside sitting with us. But in the studio, we have Indira.
Yes.
Hi, Indira.
Hi.
And Tiffany.
And Tiffany, and I know why you wanted to do first names
Yeah,
only.
because I got, we
Got a complicated last
She's
name.
coming right at you.
I got into trouble. I was just trying to be polite. I said, "Madam, how are you doing? Ma'am, how are you doing?" She's like, "My name is Tiffany." Like, okay, sorry. But welcome to Open Forum.
Thank you.
And just to let you all know, we've been doing this program, and let about 65,000 people know out there who are listening. We've been doing this. You're going to say, "How did you become 65 from 50,000?" Because that's what
That's what Natasha told us.
me. It's more than 50,000.
Right, more than 50,000.
People listening to us live
Right.
all over the world on humfmradio.com or 103.5 FM. Jagat Dinkar and I, we've been doing this program for the last 21 years.
1990. 1999.
Something like that.
Right, 1999.
After about 10, I lost count. Forget it. Yeah.
1999, I'm telling you, it's 23 years, man.
23 years. So
March.
Look, here's a story. When I was growing up, here's a story. Darshak bhai, you got to listen to this story, okay? When I was growing up, and in India, when you're growing up in 8th grade or 9th grade, they're like, the parents are already deciding what you're going to become, right? It's like, it's my life, dude. He asked me, he said, "Hey, what is 1 plus 1? I said, 11. He said, "Okay, no engineering school for you. You go to med school. You don't know how to count." I'm like, okay. So that's what it is.
That's what it is.
10 after 10, I don't know how to count, right?
As a matter of fact, the story is that he would like to narrate it. The three of us got together, not knowing where we are going. Mm-hmm. Just Dinkar came up with an idea that, hey, why don't we start a talk radio? And I said, okay, let's start a talk radio, without even any question, not even knowing what we are going to talk.
Well, that's how Facebook came. Facebook came into existence. And look at where Facebook and look at where we are at Open Forum. We're still here.
And the decision was that we will be there on 3 months. If no one supports us, we'll stop talking on the radio.
Wow.
And that was in 1999.
1999. Well, let's get back to the topic here.
But let's get back to the topic.
Houston, as we all know, Houston is the world's biggest, the largest medical city in the world.
And the best.
And the best, of course. It employs, if you look at Houston's medical employment, it employs almost 400,000
Right. It is city within a city.
It's a city within a city. But I'm just saying the entire Houston area employs about, to be exact, 376,000 folks are employed in the medical field.
Absolutely.
Of that, about 43 to 44% are in the outpatient. So you can imagine how many people work in the inpatient and the other facilities. So that's a huge amount of people that we employ, and there's a good reason. The reason is we have cutting-edge research in Houston, in MD Anderson, and other big hospitals. I'm just throwing some names out here. Great medical schools, as you know, private and publicly funded medical schools. Attracts a lot of people to come into Houston to study. So why not in a place like this, we have so many hospitals. We have so many different hospital systems in Houston. And I'll tell you, as a physician, I'm really proud to be practicing in Houston because I have patients that any specialty I can use, any hospital I can use, and they will get the best of the care. So I want to
Well, as a
welcome
matter
both
of
of
fact,
y'all.
Subodh, there was a time in the early 80s when patients from all over the world related to the heart, they would come to Houston,
Right.
get
They
it
still do.
operated at
They still
St.
do.
Luke,
They still
Yes,
do.
at a heart
do.
institute.
St. Luke's Health is a
And
great partnership.
including some of the very high political officers from India.
Exactly,
Yes.
exactly.
Including the prime minister, the presidents, and ministers, you name it.
Yeah, and so today,
everyone used to come.
Today
here.
we are extremely proud that St. Luke's Hospital has come into Open Forums, a little studio that we have out here. So again, Tiffany and Indira, welcome to Open Forum. Just to give a very brief description, Indira is a friend. I think I'll stop there now. Well,
And I
of
think you
course,
share a nickname with my husband, too.
I should.
Hey, only you know about it.
Yeah.
Nobody knows who Indira is, right?
Well, so Indira's husband is Papu and my nickname is Papu. Is that what you're
yes.
saying? Okay,
Yes.
all right. Look at that. You gave it, I have not said that for the last 21 years. You made me say it on the air. I'm going to have all
Now
these...
we have all your
all my-
secrets
yeah,
coming
you
out.
sure do. Indira's a great friend of ours, a leader, I would say, at Chamber of Commerce, the Indo-American PAC, etc. I could just go on and on. But it was very heartening to find out many years ago that you were actually on the board of St. Luke's, and that made me really feel great
Oh, thank you.
and very happy. So we're going to first talk to you, Indira. Tell us about how on earth a non-medical person got onto a board of a great hospital system like St. Luke's. Not how on earth. Why did you get on that? That's what I mean.
Thank you so much. So when back in 2008, when St. Luke's built their Sugarland Hospital, they needed community members to be part of the board, and a very personal friend and a mentor of mine, Irene Helsinger, who was then working for St. Luke's, had asked me to say, we need someone who's more who's outspoken, who cares for the community. And so I just couldn't say no to her. And I didn't know what I was getting into, completely blind.
I didn't say no to her.
So that's how it all started. And, it's definitely been very rewarding. It's a learning experience. Feel very close to the community, as you mentioned, being a Houstonian for 30 plus years. Having a little piece of me in the healthcare definitely feels proud.
Right.
And I'm glad that they're still keeping me on, but, I must be doing something right, or they haven't caught me yet.
Well,
But-
not just...
So now that you have from Sugarland, you have moved to all the way into the main area.
Yes.
Talk about it.
Sure. So I started as a board member in Sugarland and then chaired the board for Sugarland. Actually, I think I'm still chairing it to some form or fashion. And when CHI acquired St. Luke's, they acquired several hospitals within Texas. So today we have about 16 or 17, that's always debatable, across
In Texas. Oh,
yes.
wow. Okay.
So they asked me to
Huge.
come and sit on the board that governs those 17 hospitals. So, which, I'm so honored, and
So the board that we're talking about is a Texas-wide board?
Yes.
Oh, that is amazing.
Yes,
Hats off to
amazing,
you.
really.
Okay, so from Sugarland to Houston to all over Texas.
Right.
That speaks volumes of your own, your caliber, basically.
Oh, thank you.
So that is awesome. And before we ask you a few more questions, I want to just thank the Chamber of Commerce, and I would like to have Mr. Aluwalia call us today because he always likes to talk about their partners.
Absolutely,
and
yes.
about the chamber. So give us a few moments, and Jagdeep, please feel free to call. Our number out here is 1-800-749-1035. We're going to shift to Tiffany. How are you, Tiffany?
I'm great.
Lovely.
Thank you for having me. Thank you for
Yeah,
having
you
me.
bet. First of all, welcome to Texas. I understand you've done the whole world tour before you ended up in Texas. Tell us about yourself. Tiffany, of course, is the Vice President of Communications, and there may be more titles that added
Yes,
that I'm not
that
sure
we
of.
are not
But we'll
aware of.
find out. And this great hospital system, 17 hospitals in Texas, that's huge.
Yeah.
Tell us about yourself,
Well,
Tiffany.
so Division Vice President of Marketing Communications for what is St. Luke's Health here throughout Texas. In our Brazos Valley market, we're known as St. Joseph, affectionately,
Okay.
St. Joseph market. So collectively, we are the Texas Division of Common Spirit Health. which is the number one faith-based nonprofit hospital system in the country.
Okay.
And I'm so honored to work in TMC, Texas Medical Center, which is the largest medical center in the country.
Right.
And you're right. I come from a very kind of nomad land. I'm a former military spouse. I grew up originally in California, suburbs of LA,
Yeah.
but I've lived all over, partly because of the military and partly because for career opportunities. Where I've seen opportunities, I've certainly taken them, taken the advice of great mentors, and I'm here now. And I've spent my entire career in healthcare. So it's getting harder and harder to say 20 plus years. So I'm just going to leave it at that. So it's 20 plus years of healthcare marketing, communications specifically.
Right. And we're going to talk to Indira. I know Indira had her own business, and you probably still have your own business. I know.
I've sold it. I sold it
Sharma
in
and
2015.
You did, yeah. So we're going to come back to that.
Yeah.
But I want to ask you, Tiffany, very often I've seen, and having worked in hospitals, I've seen the CEO of the hospital start as a nurse or as a lab assistant. Where did you start your healthcare career? Or were you straight away the vice president?
No, I was definitely not straight away the vice president. Actually, the trajectory to get me here took about 20 years.
Okay.
And I started as a consultant, a proposal consultant with Kaiser Permanente.
Okay.
And so after you finish school and you graduate and you come out and you get your first job, going into an integrated hospital system was one of the best things that I could have ever done. When you work for the insurance and the hospital at the same time, like I did with Kaiser, it gives you a different view as opposed to just the payer side or just the hospital side. So I cut my teeth and really for 5 years learned both sides of
That's
the house.
amazing. Yeah.
And of course it's Kaiser, so it has its own alphabet.
The biggest in California.
Right.
Exactly.
Right.
Outside of just healthcare having its own language, Kaiser has its own language. So that was the foundation of my career.
And Indira, you and your husband had a very successful business. Tell us about that. And then of course, the American dream is always to sell it.
Yes.
Okay.
Yes. So we together ran this company called Hydus from 2000 to 2015, specialized in a technology company specialized in services around a very niche area, which covers all of data. So data movement, data science.
Hydus, H-E-I-D?
Hydus.
Okay, gotcha. All right.
It's not hide us,
Right,
but it's
right.
Hyderabad, US.
I gotcha. God, I should have guessed that. Okay, yeah. And then?
So,
So let me guess, you're from Hyderabad?
no, I'm from Chennai.
Oh, I got it.
He is from
Okay, I
Hyderabad.
gotcha.
He
All
won
right.
the toss.
You want the toss. Okay, yeah, go ahead. And so what
Sure.
happened then?
No, so we decided that we were at a point where we do need to have outside support to grow further.
Right.
And so sold it to an Israeli publicly traded company
Nice.
back in 2015. And, a lot of times people say that, hey, once you sell, you leave,
Yeah.
etc. But, we had the 3-year commitment, but I actually enjoy working for them so much, I'm still employed with them.
With them?
Yes.
Oh, wow, that's wonderful.
And
Wow,
that is-
fantastic.
that is amazing. And then how was your connection with the Chamber of Commerce? How did you get involved with them?
Actually, it was something called Women Wear Many Hats.
Right.
Okay, and started a program where I thought that it would be good for us to have like a panel session, and so invited many women and both Indian origin and non, and in different industries that are covered in Houston, and that caught the chamber's attention. They said, "Hey, this is great. Would you like to be part of our board?" And so that's how it kind of.
I think it is called Women Mean Business. Is that the one?
No,
That was
well,
different.
That was different.
That is separate.
The original one was Women Wear Many Hats.
Well, Chamber of Commerce has done a great job in Houston, so we have
Yeah.
an opportunity right now to talk to
Should I put my-
Jagdeep. Yeah, you should put the headphones on. And Jagdeep is online, actually. He's the executive director of Indo-American Chamber of Commerce of Greater Houston. And a lot of folks, after the show, when they listen to us, they say, hey, I want to become a chamber member.
Chamber
So we
member,
will
right.
hear from Jagdeep himself how they can do that. Jagdeep, welcome to Open Forum. How are you doing, my friend?
I want to start off by thanking all of you at Open Forum for the tremendous, great work you've been doing since 1999. And incidentally, for the benefit of your listeners, that was the year 40 plus business people got together in Houston to create the Indo-American Chamber of Commerce.
Jagat was one of
And
them.
I had the honor, I was going to come to that. I had the honor and privilege, thanks to Jagat, of becoming the founding secretary of the chamber. He was the one who pushed me into that slot. And Dr. Durga Agarwal was the founding president, so I was in very august company. Jagat was one of the founding board members who helped steer the path forward. And Indira was a former board member, as were you, Subodh. What Indira forgot to mention was she was our first Woman Entrepreneur of the Year. The year we launched the Woman Entrepreneur of the Year, the board and the committee selected her to be the first Woman Entrepreneur of the Year.
Thank you.
Because right from the day we know her, she has had a very illustrious career. And as she pointed out, she launched our women series with the program Many Hats Women Wear.
Wow,
She was also involved in a series of events with Snehal Desai focused on the next generation in the healthcare profession.
Fantastic.
So between the two of them, they put together several events focused on the needs of young doctors, residents, fellows, which were very successful. And in the near future, we hope to restart that program. Of course, Subodh, when you were on our board, you did a great job. And maybe one day when you have the time, you'll find the willingness to come back. But with that being said, I want to just thank all of you at Open Forum for the great work you do. And we are privileged to be featuring St. Luke's today, which is a hospital system doing great work in the community. And Tiffany, thank you very much for making the time on a Saturday to come and talk to us.
Oh, absolutely.
Regarding joining the chamber, you can visit IACCGH.com to get details about the chamber, about membership. Our forms are online. But you have to be able to refer a member of the chamber to be considered for membership. But I can give out my cell phone, 832-746-8372.
Nice.
Anybody who wants to learn more about the chamber can call Jagdeep Ahluwalia, me, at 832-746-8372. But there's a lot of great information on the website, IACCGH.com. And I want to thank the board led by Tarush Anand, who are doing a brilliant job volunteering their time to make the chamber what it is. I also want to give a shout out to one of our first volunteers at the chamber, a former president and a current board member, Sanjay Ramabhadran, who on Thursday took over the very prestigious position of chairman of the Metro Board.
Yeah.
That's amazing.
It's a volunteer position, but a very prestigious position. And as Indo-Americans, we are honored that he is leading the board. With that, I'll get off the airtime and give the time back to the rest of you.
Yeah, just the last question. I know you guys had a great gala last time. Of course, I missed it. I was out of town. Do you all have any save the date for our listeners listening out there? Because
September the 24th at the Hilton Americas. The board approved the date today, September the 24th, which is a Saturday at Hilton Americas.
all right, I'm canceling all my flights on September the 24th. Last time I missed it.
We are going to limit the number of people at the gala in acceptance with the guidance. But if things improve by then, we may go back to our previous numbers.
Right.
But anybody interested in the gala is welcome to again call me at 832-746-8372. But again, thank you very much for hosting this monthly program. And we all need to thank Sonal for her wisdom in guiding you in that path.
Yeah, she sure did help us make sure that we did this business hour with IACCGH. Yeah, thank you again, Jagdeep. And if there is an upcoming program that you want to tell us right now so that you don't text me later on, how's that?
We have a Women's Mean Business program. We have featuring Dr. Kamath from... I'll give you the details in a couple of minutes.
Send it to me.
And all that, because I always get my dates puzzled up.
No problem. Just send it to me or
Yeah, I'll send you the details.
Jagat. Yeah, like Jagdeep and Jagat.
Very close.
Yeah, very close. Thank you, sir, very much, and keep up the good work out there.
Thank you.
Yeah, folks, you're listening to Open Forum. Our number out, there was a couple of people who called and hung up. I guess we couldn't pick them up on time. Our number out here is 1-888-749-1035. 1-888-749-1035. And I'm going to go back to Tiffany actually first. Tiffany, tell us, what does a vice president of communication, what's your role in this big system of yours?
Well, right now, the main focus is to make sure that people are coming back to the hospitals and going to see their primary care physicians and their specialists as they need to.
What do you mean by coming back to the hospital? I mean,
so people have stayed away.
Okay, that way, okay.
And that makes sense that they did because we asked them to.
Right.
And, places of healing have been COVID focused for 2 years, right? And so now we're asking people to use their primary care physicians wherever they are, the clinics, wherever they see their doctors. We want them to go back. So right now, the biggest thing is a marketing professional in healthcare.
Right.
We're all trying to get people to come back. It's been too long. Matter of fact, we have a partnership with the American Heart Association, and our campaign is, Doctor, it's been too long.
Yeah.
I'm coming back.
And it's such a truthful statement, because I've seen in my own practice, last year has been one of those COVID hiatus. Everyone, have you had your mammogram done? No, because it was COVID. Well, you were due for a colonoscopy last year, dude.
Exactly.
Well, it was COVID. Okay, the COVID is now, behind us, I think. It's my opinion. It's really gone down, the cases have. So I think you're absolutely right when you have that proposal that come on back to the hospital. We are open for business. We want to take care of your health. I think that's a very true statement. Thank you for. Is that like your focus on St. Luke's statement right now?
I can tell you that our CEO, Dr. Doug Lawson, that's his focus right now.
Okay.
Yeah, and that is of our entire health system right now, the focus. But really, engaging our patients. And engaging consumers in general about health and wellness in a different way, innovative tools, using, the website to make sure that we're discoverable and seen, and making it user-friendly. User experience is a really big deal. A lot of my focus has been on digital marketing and just engaging with people in the way that they need to be engaged in.
Right.
So as a marketing professional in healthcare, it's finding ways to talk to the people. And that's been the biggest focus. But, we focus on everything from our IT initiatives and digital marketing to, traditional at-home. And actually, I have to say, as part of Common Spirit Health, the Texas division, St. Luke's Health, has our very first of all Common Spirit Health ads for smart TV. So that's a really big deal. The fact that we have Hulu ads, Sling ads that have QR codes that take you directly to our PCP pages where you can find a doc and make an appointment.
Fantastic. So, every system boasts about themselves. Indira, as a board member, boast about St. Luke's. Tell us about St. Luke's. If you between the two of you, probably,
Absolutely.
The number of beds you'll have, the services that you'll provide, and what is one service that you say we do the best in this city or the town or Texas maybe?
So, one of the things that I'm really, really proud of St. Luke's is when Sugarland Hospital opened, it was nice to have the community hospital. It is not as if, it's intimidating for someone to go to medical center, to find parking, pay the fees, and go there. It's very intimidating. And so when they started really expanding to the community, it was really nice to say, you're here until you graduate to the medical center. Right? So as long as we can provide services here, we should be able to.
Right.
And so to see the way they grew for in 17 different areas within Texas, has been extremely rewarding to see, because it is not as if someone who's in Lufkin have to drive out to Houston or College Station, and you can still get the same service. But and also when they do come to medical center, it's not as if they have all the history that they need to repeat again as a patient who's probably ill. It's all in their EMR.
Right.
And so it's really been nice to see that. And so I think that has been one of the most rewarding, and I've experienced it personally with my family as well. And so it I really, and I'm sure all the other hospitals are probably doing the same, but being, I'm a little
Biased.
partial to.
It's okay. Oh, yeah. But you're right. 20 years ago,
Yeah.
we were all doing paper charts, and
Yeah.
it was so difficult to get medical records. Where were you admitted? That hospital. Well, it's a sister hospital, but we still couldn't get the records. Now it's all on EMRs and X-rays, CT scans. You name it, it's all there. So that's a great innovative move. All the hospitals have made. How many patient beds do you think we have all across Texas?
Oh, wow. That's
too many?
Loaded question here.
Yeah.
More than probably 2,000, right?
I would say so.
Yeah,
I know that we
because
have
just the medical
ballpark,
center
yeah.
itself.
alone
yeah.
well, in the medical center alone, we have 800 beds.
Okay.
And I think we average about 450, 465 that are
Okay.
used at any given time.
Fantastic.
Right.
If it's one service that you would say as a board member, because you get a lot of information during your board meetings, what makes you very proud of at least one service that you can tell us?
Wow. It's
And I know you're going to say we could do everything. Fantastic.
No.
But I need that one that you
yes.
think.
No, and actually someone asked me the other day that, hey, which is the best hospital in Houston? I said, it depends on what you're going for.
Right.
Right? It could be MD Anderson could be there for cancer, et cetera. So it's not really everybody's married to one hospital.
Right.
For us, I think heart health has been,
Okay.
and the affiliation with the Texas Heart Institute
Absolutely.
has definitely been one that I'm very proud of. And actually, when Mr. Jagat mentioned about a THI and how there's been so many dignitaries, we actually walked through before Modi came along with his medical staff, the THI, the atrium and the floor. And actually, there were a couple of prime ministers of India who had come in for their surgeries, and actually, there was pictures of them,
Yeah.
which everybody was proud to take with. So yes, it's been there long, and it's a very great reputation, and I think that's one thing that we
heart.
really and February being a heart health
Right.
month
Sure
as
is.
well. It's a perfect time for me to say that as well, and definitely I think people tend to neglect it until they have some symptoms. So,
And Jagat, we've discussed this many times. Texas, in Houston, St. Luke's was
The
a
place.
cardiac place.
Right.
Yeah.
Now, and you're saying it still is. So
Absolutely.
I'm learning that even more from you now. So it obviously, because of the reputation of the physician that they have hired out there,
Well, started with the
surgeon.
famous doctor.
Right.
So,
You're talking of Cooley.
Cooley.
Okay.
Right.
Yeah. Of
Cooley,
course,
yeah.
definitely.
And DeBacke.
And yeah,
DeBacke, right.
exactly.
Yeah.
Michael
And
DeBacke and others.
yeah, the
There's so many
DeBacke
others,
was
yeah.
with Methodist and Cooley was with
And where do you
St.
see
Luke
then the growth of? So you got the best out here now. Where do you think that St. Luke's really needs a little more growth? Is it pediatrics? I don't know if St. Luke's does a lot of
No.
No,
pediatrics.
Well, I think
doesn't do
that's-
pediatrics.
Y'all do none, maybe, if I remember.
probably an affiliation with Texas Children's.
Yeah.
So y'all,
So,
so y'all transfer patients too. So you don't have
Right.
a pediatric section. If I know y'all have women and children because y'all do have
Right.
birthing centers out there.
We have a
Correct.
wonderful women's service service line, and actually we just launched Babies at St. Luke's.
Okay.
So now when people come in and they have the babies, we have a whole web page now.
Exactly.
Where we have
That's-
the babies are featured. We just did a soft launch, and we're
I think
pushing that.
I think that basically it became quite famous all over the world because of the Heart Institution.
Yes.
Institute. And I think you need to ride that horse and just keep on moving on it.
I think the Texas Heart Institute would love that you said that. And, I just wanted to just add on to what Indira was saying, because I think, as a healthcare marketing professional, working in TMC and representing St. Luke's Health, I think the strength is, one, we provide the same high-value, high-quality care throughout our entire health system. And with, 16, 17 major hospitals, that's a large feat to do. And I think another thing that sets us apart, yes, Texas Heart Institute, but I think that's because we sit on a foundation of partnership. So we have affiliate partnerships, and we have clinical, and we have academic partners. And so I just want to shout them out so that we don't just talk about Texas Heart Institute, even though we love
Right,
them.
agreed.
Yeah.
But we do partner, as you said, with Texas Children's Hospital, with Baylor College of Medicine, absolutely.
yeah.
Texas Heart Institute, of course, Kelsey Subodh. And then down in our St. Joseph market, we partner with Texas A&M and provide their care. We're their go-to official ortho, sports medicine, affiliate and partner down there. So I think from a marketing standpoint, it doesn't get any better as a marketing professional to work, at St. Luke's Health because of the strength of our high quality, high value healthcare that we provide and our partnerships.
So I'm getting text messages. Look, guys, you can text me the question, but maybe you can just call us directly.
Exactly. I think the calling would be much better, wouldn't
Yeah,
it?
so our number is 1-800. 1888. Yeah, you keep
800,
distracting me.
you know.
It's 1-888-749-1035. First question was for towards you. What's the meaning of a board member at St. Luke's? What does a board do, and what's your role in there?
So a board member, and perfect timing, I just had my annual board, our seminar, just to make sure that we know. We have a fiduciary responsibility to ensure that there's governance within the system. Cut across various areas. So it could be anywhere from the operational side, quality of care, making sure that the physicians that we are onboarding are the right physicians, financial decisions. So it cuts across the board.
Basically.
All compliance,
all
yes.
compliances, yeah.
And so, in addition to the board, we also have an audit and compliance as well, which requires. The good thing is that you pretty much understand you are touching the entire end-to-end of any hospital system. And so, those meetings are pretty long, and we do have to really understand a lot of it. But I think the most important thing in my eyes for a board member is, are we doing what we're supposed to do for the community? Is St. Luke's doing that? Okay. Are we doing it as we should be, in a regulatory compliance manner?
Right.
Okay. And is this something that is well received by the community?
And the focus is the patient. Basically.
Absolutely.
Yeah, right.
Patients are always number one. So when you talk about quality of care, it's all about patients, safety, it's patients. So it all boils down to the patients.
So you've been a board member for 16 years now?
Oh my
16,
gosh.
17?
Yeah,
Almost?
14 years or so.
Describe your first board meeting and then describe your last board meeting.
So you get a board packet right before, and I must have gone through that for a couple of hours going, they're going to ask me questions about this, questions about that, Googling stuff. And
they're going to say, Dr. Indira, what do you know about... What? Is that what you were thinking?
I don't know.
And you read the whole thing, right?
Yeah, I don't want to...
Which is amazing, because I've been to many board meetings. The packages are so huge, you can barely, read the summary. So, how was your first board meeting?
Very nerve-wracking, and it was at that point in time they were partially physician-owned hospital, the Sugar Land Community Hospital.
Oh yes, I remember that.
Right, so it was there. You have physicians, and the physicians are looking and going, "Who is this woman?" And who is this person who has no medical degree or anything part of this? So, it took a little bit, but the key is, one of the things I'd say to anybody who asks me about board positions is don't hesitate to ask questions, even if you can't understand. If it's an acronym, you're not expected to know everything. So that's how you learn.
Yeah. So now on the board, how many physicians are there? Are there any?
Oh yeah, there's always going to be. So there's.
Are there majority physicians or minority?
No.
Okay.
So the system board, you'll always have a representative physician from Baylor College because we have a joint venture with them. Right. And I think there's a representative from Kelsey as well. So at least you'll have I think we are, don't quote me, we're supposed to be about 18 or so board members. I don't know if it's completely, you at least have 2 board members that are physicians.
The president of the group sits on the board meeting also, or no?
Absolutely.
Yes?
Yeah, the CEO.
Is he part of the board? Or no? Or he's invited to the board meeting?
He is part of the board.
Okay.
But he does not chair the board. So there's a chairperson for the board.
Okay.
Who is
All
not.
right. But then the role of his is just to present, his or her, just to present.
Yep. Yeah, he presents about the report.
Right.
And he,
state of the hospital.
Exactly.
Basically, from A to Z. And it's extremely important. The reason I asked you how many physicians versus non-physicians is that even when I was the chief of staff at other hospital, Memorial, we made sure that even on the MEC, Medical Executive Board, we always had a member, because MEC is comprised of physicians only, the CEO, CFO, etc. But we used to always put a a person from the community.
Yeah.
So he may be an engineer. He may be a priest, a pastor from somewhere. So they kept us really clean, because when what we spoke out there was a community member listening to us. So we were absolutely honest and clean about the affairs of the hospital, because we know we have a duty, as you said,
Absolutely.
to the community, to every patient who walks in and walks out of the hospital. We want to make sure we are consistent, we have the same quality of care, and it's always superior to the last year's care. So a community member and a non-physician member is extremely important.
Especially in Fort Bend County, given that it's such a diverse community, you need to know how to cater to patients across, you know, different ethnicity, different economic background, economic status. So it's a very
very
complicated
important.
community county,
Right.
and it is important.
Fantastic. Hey, folks, you're listening to Open Forum. I want to thank the Indo-American Chamber of Commerce of Greater Houston. We partner with them, and this first hour is in collaboration with the Chamber. We have Tiffany and we have Indira. Indira is a board member of CHI St. Luke's. 17 hospitals in Texas. No little joke out there. That's a big commitment that you have, placed upon yourself, being a board member. And of course, Ms. Tiffany, you're the Vice President of Communications and
Marketing.
Operation. And marketing. Sorry. So my next question is towards you now. What about the competition that you have? You see, you came from Florida about a year ago, right? You probably read the market out here. I hope you did.
Yeah.
Well, I'm getting into St. Luke's, but then we have two big hospital systems, maybe three. There's HCA also now. What do you think about your competition?
Well, I think what it is we need to focus on what we do well.
Okay.
And what differentiates us.
Okay.
And I think built on a foundation of being a faith-based nonprofit, I think that's a huge differentiator.
Okay.
So I think what Indira was saying about what we do in the community, yes, from a fiduciary standpoint, this is something that we need to make sure that we take care of. But we have a larger, I think, aspiration. And we express that through Hello Human Kindness, which is our brand. Throughout all of our divisions under Common Spirit Health.
Human kindness?
Hello
Human kindness. Oh, hello, okay.
And so I think what we do is we really focus on us.
Okay.
And we really focus on how can we express our Hello Human Kindness aspirational brand. And of course, we understand what's going on. But I think, during the pandemic, what has taught us is that we are stronger when we work together. And so I think the foundation of our partners, our affiliate partners, academic, and clinical partners, I think what we focus on is what we do well, and then if we don't do something as well as others, that's why we have the partnerships and the foundation of it. So I think, yes, it's healthy competition. We can't and don't want to treat all. Some it's better that they seek care someplace else, as Indira was saying. So we don't really focus on it from a competitive standpoint. What we do focus on is taking care of patients in the best way possible.
Okay.
And when we are the number one in the best way possible, then we focus on that.
There you go.
Tiffany, I got a question for you. It's a faith-based institution. When it was bought out by faith-based institution, there were a lot of discussion going on in the Houston newspaper and in general that what kind of treatment is going to be given when it is bought out by a faith-based organization. And there were a lot of discussion going on, which I don't want to go into the detail of it. Does it have any impact? Did it have any effect at all on the operation of the St. Luke Hospital?
So I've been there for a year, so I can't speak to the operation of any of our hospitals, our entire health system prior to a year. I know that right now we treat each patient the best, give them the best care possible. Based on what they need. But I think Indira was...
Indira probably, she has an answer.
Yeah. Well,
that the whole...
I'm part of a board of a faith-based organization, which is not the faith I practice. So I can speak very freely to this, is that... so just to give you an idea, it was St. Luke's system, St. Luke's Episcopal got bought out by Catholic Health.
Right.
But Catholic Health and Dignity merged. Pre-COVID, I believe it's right.
Yes,
right.
yes.
Right, a couple years before.
And the name is Common Spirit. It is no longer a Catholic health in any way. And the common spirit is really to say we are faith-based, but we are together, come together in what we do. From it's something where it's not necessarily specific just to the Catholic institutions.
And that's the whole point of the new name is we're coming together for the common good.
Yeah.
And it's a common
and
spirit.
it was a very thoughtful name because when you have Dignity Health and Catholic Health merge, and they decided to remove Catholic from the name, it speaks volumes. It speaks that you're here for the community, regardless of what faith they are.
Welcoming to all, just faith, just have faith, right?
Right. So the next question we're going to ask you is, as you know, the healthcare system in United States is number one in the world. And we still have a lot of gaps in the delivery of the healthcare system. We have a lot of uninsured people, although we've talked about Obamacare, et cetera, there's still a lot of people out there who are uninsured. What is the role of St. Luke's CHI in taking care of these uninsured patients? Is there a budget allocated to charity care, et cetera? Would you like to elaborate on that?
No, I mean, regardless of if you're insured or not insured, self-pay or charity-based,
Right.
you get the same service. And I've seen
agree
this.
with you. Yeah. Yes.
And so it starts from the floor.
Right.
And regardless of what you have, I've seen that the service has been the same across the board. And yes, we do, if one cannot provide and one is unable to, with the supporting information, we will put that towards charity. And it's very much accepted that that's going to happen. Percentage.
Right. Because when you get admitted to the hospital, the doctors and the nurses, they do not know that the patient has an insurance or doesn't.
We don't even ask.
Exactly, and you don't even ask, right? So as far as the care of the patient is concerned, I don't think there should be any difference whether one carries an insurance or one doesn't carry an insurance.
Right. But I guess I could have rephrased it. Is there a budget allocated for something like that, or is it just one case by case?
Isn't that a federal budget that's allocated to some of the uninsured people?
Well, there are certain federal budgets where if they qualify, for example, you have someone who has kidney failure, and that's the easiest example to give. Say someone in United States of America, you have kidney failure and you get on dialysis, you automatically get onto Medicare.
No,
so
but that is true. That is one thing. But the people patients who get admitted to Bentab Hospital, that who do not really have the insurance, or they carry that gold card,
right?
And many of them, they do not have the insurance, and the federal government pays for that.
Right.
All those services.
There is a budget. It's a very small budget, but yes, there is. But there's a lot of hospitals that just write off
write off.
So,
right. Yeah. Go ahead.
To my knowledge, do we allocate a budget? It's hard to, because we don't know how many patients are going to come at any point in time, and we don't want to get to a point where we'll say, "Oh, we've gone over budget."
Right.
No, but we do have a good foundation, though. And,
yes.
And so the vice president of our foundation is Dan Martin. He's done a terrific job. He came on a few months after I did.
Like a charity foundation?
Exactly.
Okay, I got you.
So our philanthropy, actually, it used to be called, his title was changed, but it would have been, if he came on like a year or two ago, the VP of Philanthropy.
Gotcha.
So through the foundation, and we have a foundation at Common Spirit Health, and then each division has its own foundation vice president.
Fantastic.
So he's charged with making sure that we give and provide and partner with and provide care out in the community as needed, what you're talking about, to fill in those gaps. As a matter of fact, we partner with the San Jose Clinic to do just that. They're an urgent care walk-in clinic, and we help and give them funds to take care of people when they come in. And then, like Indira said, absolutely, when people come in, we give them the same high quality, high standard of care. And then if we need to fill in those gaps from a monetary standpoint, then we look to the foundation to help us with that.
Right.
But I think what you're also getting to is, Common Spirit Health in general, and then St. Luke's Health specifically in Texas, we are part of a Pathway Community Hub model. And we just are launching it. I'm really excited to talk to you about it. We just had a meeting yesterday. So the program director out of San Francisco.
What's it called again?
It's called Pathway Community Hub Model.
Lovely.
Right. And I have to I have all my notes over here.
Absolutely.
I'm kind of nerding out about this because I get really excited about social determinants of health and then how we're helping make a positive influence. So Pathway Community Hub is a new something that we're launching to kind of fill in those gaps from a social determinants of health or SDOH standpoint. Brian Lee is the new program director. He's actually going to be speaking at a conference about it because we're just launching it. And we have a pilot in outside of San Francisco, Northern California. And we have like 5 different of our divisions who are doing pilots. We're actually going to be bringing a pilot to Brazos Valley. And basically, we understand that we are actually accountable for helping to be a hub in the community to close those gaps, to take care of helping people get to the resources that they need. And I think what you're getting to is those are poverty-based gaps.
That's the community health we're talking
Exactly.
about. Yeah, exactly.
Yeah.
Okay.
And so, because it is our responsibility, as Common Spirit Health in our different divisions, and we see our hospital as such, and having the focus and the responsibility to take care of people in the community, we're starting this. So we're going to.
So is that focus going to be then on preventive care kind of a deal?
Absolutely.
Because
Well,
that's the key to healthcare.
I think you're right.
If you prevent that.
Absolutely.
That diabetic foot,
Yep.
or the kidney from diabetes, and that's where the key is. Yeah.
Well, it's recognizing where people have those gaps and have those needs, and then getting them to the right resource. That's exactly what the hub is supposed to be doing. So I can bring you some more later. I can come back next month and talk to you about how the program is going.
She loves that program.
Exactly.
She
Look
wants to
at
come
that.
back. Yeah, we'd love to have you back again. Definitely.
We're just launching it.
Right.
Fantastic. Anything to add to that? I mean, again, we talked about prevention of disease or preventive medicine in a disease. Diabetes, for example, someone knows they have diabetes. There are 5 things you've got to do to prevent this person from either having a heart attack, stroke, kidney failure, amputation, and other things, right?
Right.
So if you cover those 5 in primary care, you don't have to use those dollars.
Exactly.
That can be allocated to other preventive
Exactly.
care. And that's where I always tell my hospital systems that is where your focus has to be. And a lot of the European hospitals do that, Jagat.
That's where the PCP comes into the
That's
picture.
where the primary care, unfortunately in USA, primary care doesn't get paid enough.
No, it doesn't. Right.
So folks don't go into primary care. It's people like me who go to primary care.
I
We
know.
enjoy it. We love
Yeah.
it. But that's the focus that we need to have in healthcare.
I agree.
How do you prevent it? How do you go into little towns and prevent it? Why we don't want people being transferred from small towns into big towns. We want them to stay there because we want them to stay healthy and not have a diabetes, a blood sugar of 600, and then they get
Yeah.
transferred to us, right?
Well, that's why we have such a large health system throughout Texas. And I take a lot of pride in the rural hospitals that we have. One of our hospitals is called San Augustine. It's out in East Texas. It's only 20 minutes away from the Louisiana border. And for 3 years in a row, we've gotten leapfrog patient safety, quality, highest standards. That is one of the best hospitals that you can go to in the entire country. That's a critical care access. It's only 8 beds out there. And the level of care that they provide to that community is tremendous. They take care of the people there so that they don't have to drive. The nearest hospital is about an hour away.
Wow.
And they were really integral during the height of the pandemic.
Oh,
They really took
yeah.
care of people, stabilized people, and then got them where they needed to be.
Right.
But you're quite right. We need those types of resources everywhere, not just Texas Medical Center, and we need them out in the suburbs. We need our Sugar Land hospitals.
Right.
We need our the Woodlands Hospital, the Lakeside Hospital. We need our St. Joseph Hospital out in Brazos Valley, and we need our San Augustines in East Texas.
Are y'all recruiting or, I guess recruiting is the right word, more primary care physician in your network? Because I think, again,
Absolutely.
yeah.
We have 2 primary care networks that we recruit for.
Right.
So down in our Brazos Valley market, that's St. Joseph Health primary medical group.
Right.
And then everywhere else, we're building out our Baylor College of Medicine, so our Baylor Medical Group physicians.
Wow.
Absolutely.
And focuses again on preventive medicine or everything.
Yeah, I mean, we want people to see, and you were right, and what Indira was saying was exactly correct. We need to see our PCPs as the health are health hubs.
Right.
Like that's where you should go to start.
Medical home, as we call it.
Yeah, that's where you should go. That's your hub to start there and talk to your PCP, have a relationship with your primary care physician, let them know what's going on, and let them help you guide you through to the rest of the services that you need.
You're so right. Jagat, many times I see patients in my office,
Right.
and they would never have seen me for 2 years. And I ask them, where were you? Why are you here now that you're so ill?
Right.
Well, I was seeing my cardiologist. Well,
Right.
yeah, but the cardiologist does only one thing.
Yeah.
Here we are trying to take care of the entire human being. Well, I saw only my whoever, So the emphasis has to be, and every insurance company needs to also take charge of that, is that you have to actually go see your primary physician, be it a pediatrician or family
Exactly.
practice or internal medicine, at least once a year. Jagat and I have had a lot of arguments about healthcare system in the USA.
Let's not get into it.
No, but the point I'm trying to make
Right,
is
right.
the healthcare system in USA. We talked about Obamacare and Medicare, Medicaid. I think one of the things that we need to do in USA is to give everyone, a voucher that says this is your ticket to see your primary care physician once a year and it's free. That's what needs to happen, and then you will see how things will improve.
Right.
That's been my stance for the last 20 years. But who the heck listens to me?
Well,
I don't
that's
know.
right.
No one listens to me. I wish someone would love me.
Well, no one listens to us, when it comes to healthcare.
Except 60, 70,000 people.
Yeah.
Folks who
Because,
listen-
it's really interesting, particularly healthcare. No, it's not even the adults, even in the children, in the adolescence area. But I see some of the patients, in my wife's clinic. They just, sometimes you wonder they're so obese and, having a diabetic conditions. You're talking about 13, 14, 15 years old,
Yeah.
And if you don't take care at that age, then definitely you are going to have problem later on in your life.
As a
And
board,
that is where the education comes into the focus. That's what I look at.
you're absolutely right. Indira, as a board member, what's your vision now for the future of St. Luke's?
We want to be
I
able
mean, you guys have grown by leaps and bounds, so what's the next step now?
Well, as we grow, we want to make sure that we are still keeping the quality in mind
Okay.
for patient care, and that's pretty much what we really want to be able to focus around, is providing the care, improving our quality. There's always room for improvement, and making sure that we're looking at all the different aspects that in reference to patients, and making sure that we don't slack off as we grow. As you grow,
Right.
sometimes you tend
Right,
to
yeah.
slip on things. So that's been really what our CEO's vision has been, and I speak that it has to be the same.
Absolutely.
Just providing
And,
the care.
and part of the board, again, you guys deal a lot with the nuances of insurance companies. How does St. Luke, she's going to laugh at that one, because right now there's a hospital system and Blue Cross and Blue Shield, they're like,
Oh, gosh.
you know what I'm saying?
Particularly memorials.
So,
You're going to get me in trouble.
Yeah, no
That's all right.
comment.
Everybody knows about it,
No
man.
comment.
Everybody knows about
I'm
it.
going to speak for us and both say no comment.
No comment.
But I
Okay.
will say this though.
yeah,
So
you can make a comment on that.
I
know.
would be remiss though if I didn't say we have dropped the name CHI in the Texas market.
What's it called now?
Just St.
St.
Luke's.
St. Luke's.
Just
Okay.
St. Luke's Health. Because if I don't say that, I'll get in trouble later.
All right.
It was before I
Thank you
got
for educating me.
No, it's
So,
okay.
thank-
It's before I got here.
Okay.
And so it was an education for me. CHI is a legacy, and we certainly have that as part of under Common Spirit Health.
Right.
But here in Texas, it's just St. Luke's Health. I guess there was a focus group put together because there's Chi hair care products.
Yeah.
Yes.
So-
and that's also
Yeah.
based in Houston.
Yeah, which is really big here.
Right.
So they were like, we kind
I
of
think it's a
refer.
good idea.
We
Right,
refer to some of that internally, but
the entire
externally, it's
system
just-
was known as St. Luke Hospital.
Yeah, just
So I
St.
think
Luke's
it's an
Health.
excellent
Just
idea
St.
to
Luke's
drop
Health.
CHI.
It's
Absolutely.
got a
We're dropping
huge
CHI from
name.
everything,
Yeah.
Right.
from buildings as fast as we can. That's
Right.
one of the projects on my project
Right,
plan.
right,
So
yeah.
it's just St. Luke's Health.
Okay.
That's a better way of marketing the whole.
Yeah.
So I will not ask you the question about insurance companies, but I'm just going to let this out because I want to let it out for the next 15 seconds. It's a monopoly. Let me put it this way: there are 5 or 6 big insurance companies. Although I call it a monopoly, there are 5 or 6
is- it
big
is a
ones
monopoly.
who can really dictate. It is terrible. Let's just put it
It
this
is
way. And it's
terrible.
not fair, to who? The patients.
Yeah.
Because there are patients who have been seen by physicians for 15 years on that same insurance, and now suddenly in the next 24, 48, 96 hours, they're going to be scrambling.
And the
trying to see.
CEO making $15 to $20 million.
Easily.
Well,
And there's nothing against making money,
Nothing
but
against
if
making
you
money,
make it
right.
for and not take care of what you're supposed to do,
Right.
it's terrible. And that's 15 seconds up.
Well, I will say this. We definitely want to do what's best for our patients.
Right.
And we definitely want to stay in network, and we do whatever we can to stay in network with our payer partners
Right.
as much as possible. So we're in negotiations when we need to be, but our goal is to provide high quality, high value care. And so, at some point, we got to get paid to do that, so that we can put money back into our health system to take care of our patients. So that's what I will say about that.
When you moved into Houston, Tiffany,
Yes.
as the vice president of communications, what was the first thing you saw that this is an amazing thing? I mean, what really, were you in awe of something when you just saw
Yes,
and
the
joined
food.
this company?
The food. I'm sorry.
Not the cafeteria.
The food
But
capital.
let's talk about the food first. St. Luke's, how's St. Luke's food?
Well, the Midtown food. Huh?
Yes, we're talking about the Houston food.
The Houston food.
Oh, you're talking about the food in Houston. Okay, yeah, tell us about the food in Houston.
No, just like every week, I'm discovering a new Mexican restaurant, just something. There's always some wonderful, great restaurant, and I love that.
Which Indian restaurant have you been to? None.
No.
Jagat,
I
put
did-
her on our list.
No,
of
no, no.
people to take.
I will need to pick them out. Right. Well, the very first thing when we went for a coffee,
Right.
when I did, she was already there, and says, "Well, I asked for a coffee." I said, "Can I also have a samosa?" And I said, "What?"
Welcome home, Tiffany. Yeah, I like that.
Absolutely.
I said, "Where did
absolutely.
you get a taste of samosa?" Then when you said that, okay, I'm from Los Angeles. So
Yes.
Okay, I said that makes sense.
Yes.
Well, we've got about 3 more minutes in this segment. Time really flies when you're having a good time.
Yeah.
Well, we got a question here.
yeah, go ahead, please.
For you.
Oh, okay.
Are you ever going to partner with the chamber regarding the health series?
I would like to.
Okay.
So it's we've been doing some health series stuff, but I think what maybe they're referring to is the business of medicine. It's more for the residents and fellows
Yeah.
to educate them. I would love to do that again. And as a matter of fact, that was one of the first things that the Chamber and St. Luke's collaborated. We had it at the Texas Heart Institute atrium, which is
Right.
phenomenal. So I would like to do that.
They were doing it with Snail Desai. There's a good friend of yours, right? Subodh?
Yeah.
Snail?
Yeah. Yeah, I think it's important to understand for St. Luke's, especially that when you have IACCGH series, a lot of people show up, as you know. I mean,
Oh, yeah.
Oh, yes.
and they have it on their website, so people are just looking at it again and again. It's great marketing for y'all, and it's great education for the audience. So I think it's a great partnership. We would love to see St. Luke's be part of that IACCGH collaboration for
Absolutely.
these healthcare series. So, and I know you being the VP of communication and you being on the board, y'all can make it happen.
Well, listen, we were sponsors of the gala.
The gala, one of the key
Right.
sponsors.
But so that's a one-time thing. But I'm talking of this series of healthcare, talks. You
So
have so many
that-
of your own St. Luke's physicians who can give beautiful
Yeah.
talks. And all the
agree.
lines of like the cardiology, oncology, whatever you want to do.
Right.
You bring one speaker every quarter, and it's going to be
I love how
phenomenal.
you're looking for my sponsorship dollars,
I do,
like here
I do.
on air. Like it's
I do.
just
I
in the hot seat
I'll
to
be,
like
I'll
commit.
be honest, I went into the wrong business of medicine. I really should have been a marketing guy. That's what I think.
Yeah, I mean, you're just making me commit to sponsorship dollars right now.
And we do have a form outside.
Oh my goodness.
Before you leave, we have a pen also.
Oh
You
my
just fill it
goodness.
out.
Well,
I'm just kidding.
I will say one last thing
Yeah.
because I would be remiss if I did not. So I have to say that in terms of sponsorship, you're absolutely correct, and we'll talk about that. But I also have to shout out one of our sponsors, which is American Heart Association, like I
Okay.
said before, because Mel Edwards is like the senior vice president of I think membership,
Right.
but she represents all of American Heart Association and our partnership there, and then she's got a great team, and I work with Larissa Jacobs, who's the vice president of health strategy for AHA, and then I also work with Stacy Christian very close. So it's a really good team over there, and we have a really good partnership, and we're really excited about partnering with It's Been Too Long, because exactly what we're talking about, to kind of sum up our whole conversation, go talk to your PCP folks.
Yeah.
Really, just get in contact with your primary care
A
physician.
lot of the hospitals also partner with other, you talked about the American Heart Association, but then there are March of Dimes, and
Yeah.
et cetera, et cetera.
Yeah.
How does St. Luke's look at that, marketing with different organizations, non-profit organizations?
Yeah, well, so another big partner that we have is Houston Public Media.
Okay.
And actually,
PBS?
yes,
Okay.
I might get in trouble because I didn't mention them before, so let me correct that now.
Please do that.
We have a regional Emmy award-winning series called Tested.
Okay.
You can see that at the Houston Public Media website right now.
Mm-hmm.
We're working on a second, so that was an 8-part series that focused on what was going on during the pandemic,
Right.
how we provided care, what we were seeing, what were the needs, wonderful patient stories. And how we provided care, and then working together in partnership with other health systems within the TMC. Absolutely.
Yeah, absolutely,
And we're
yeah.
working on another series right now with Houston Public Media and the folks over there who are wonderful to work with. And that one's called Examination, because what we found during Tested, now we're going, we have to examine that because it really revealed itself. So some of the stuff that we already know, right? Communities of color that weren't getting care, we couldn't get to them, not getting tested, and all that kind of stuff, right?
Right.
So kind of revealing all of those SDOH and all of that stuff that we have to really examine.
Yeah.
So we call the next series Examination. We're in the middle of producing it
That's
right
fantastic.
now. So we partner where it makes sense to get awareness, education, to get the word out. And again, I was talking about San Jose Clinic under our foundation. So we have a lot of partnerships in the community.
Do y'all do anything for students at school, for example, school physicals, athletic physicals, partnering with St. Luke's?
Yeah, actually, we have surprise sport.
See, I know
we have
a lot. I know a lot about your.
You
I
do.
know a lot about St.
Wait a
Luke's.
minute.
I'm just trying
You've
to-
been doing your research. Well, we're sponsoring physicals. Actually, I think it's happening either this weekend or next weekend. There's a lot of emails going back and forth. So we
Right.
have like a big physical clinic
Yeah.
that we're doing, and I'm sure that you're affectionately looking at that because I've done my research on you too, sir.
Oh my God! No,
And
you
so
have
yeah.
My name is Subodh Bhuchar, and I stop at that.
No,
There
because
there is no MD.
you have a wonderful sponsorship that you do of high school students, from what I understand, who want to go into the medical profession, and you
Right.
mentor high school students,
Right,
don't you?
I do. I sure do.
So it's important to do
Where
that
do you
out in
read
the
that?
community.
Is it in Google?
Tiffany, if-
It's important to do that
Oh
in
my
the
God,
community.
yeah. I do teach, and if I'm going to be playing my own
Yeah.
trumpet out here, let me just finish it. Then.
Yeah.
I think all physicians, not just me, his wife does the same thing. All physicians have a focus of how do you impart your knowledge to the next generation.
To the next generation.
And Darshak knows it because I see his baby in my office, and when he comes to our office, he's seen a lot of our students. Haven't you,
Right.
Darshak? There are a lot of students always hanging around with me, learning, and I'm trying to teach whatever little I
Right,
know.
true.
Because I do, and that was another thing that Sonal had taught me. That look, you were lucky to go into med school. You went into one of the best med schools. What are you going to do for the next generation? I'm like, I'm paying for their med school now. No, not your children. The other kids. So that's when the program started. We started teaching nurse practitioners
Right.
and taking medical students. I found it was more rewarding teaching the nurse practitioners because they really got involved into seeing
You're
patients with
absolutely
us.
right, because
Whereas
Shobna
the-
tells me the same thing.
Right.
that
Whereas the students
it is
were
much
good,
more rewarding.
but there was like 4 weeks. They wanted to just get the signature and get the heck out of there. The girls and the nurses,
Right.
they want to learn.
They want to learn.
And it is my passion. I've taught over 200 nurse practitioners in the last 2 decades,
Wow,
which
that's
seems like a
wonderful.
small number. It's a huge number. And most of them are practicing somewhere else and taking care of patients. So that's our focus, education, whether it's high school. We do volunteer and take a lot of high school students.
We do, right.
So that they understand what medicine
Right.
is. Everyone's not cut out to be a medical doctor or a nurse. They need to remember this is what we do, and yes, this is what I can do in the future. So I have a lot of high. Now, having said that, I don't want people calling me and saying, "My son is going to school tomorrow. Can you please put me on that?" No, I
know.
cannot do
You're
that
right.
because I don't have that time. I have a schedule. People have already filled it up for 2 years. In next 2 years, we've filled up. But that's the focus that we have. So I don't know where you did your research, but you did a good job.
Well, there's some other stuff, but I'll next month when I come back next month.
Well, she's
love
tough.
this girl.
Let me
Tiffany
ask you
also.
this, Tiffany. With all these things happening here, the care about the children and all these things. Let's talk about the minority community. Do you have any clinics set up in those areas where instead of them coming to the hospital, they just go for the primary care?
Very good point.
And take care of patients right there and there instead of them moving to the hospital.
Just before very good point. I think mobile primary care units from St. Luke's or whichever hospital system, I'm just throwing it out.
Again,
is
you're
an
spending my
amazing-
marketing dollars. I love this.
I'm telling you.
So,
Mobile
DL, are you
primary-
listening to this?
Oh, yeah.
This is going to be in my budget. Ask for community partnerships. So,
Yeah. Well,
Right.
the thing is, again, my focus is on preventive medicine. And we can only prevent medicine if you go out into the communities, figure out these children that you have, they're beautiful kids. They're going to be future citizens. Are they immunized? Look at their health.
Exactly.
Look at their the dietary requirements. Are they getting enough nutrition? Are they getting too nutrition? Some of them are obese. So how can we fix that now so that we don't have to spend millions of dollars later on? A van can easily do that. 5 vans can do that even better. But if you have 20 vans doing that,
Right.
Tiffany,
Right.
you're going to say Open Photo is awesome.
I know.
got that idea out there, Jagat Bhai and Subodh, and that's going to be awesome.
let's go. As long as we can bring samosas and coffee with us, let's just get in the
We
vans
can
and
do
go.
that. And this is in all seriousness, though.
Yeah.
All right,
I know.
absolutely.
Yeah, absolutely. Well, I will say this. I think, again, through Tested, and when you look at the series, you'll see it revealed itself a lot of what we need to do out in the community. So in the new examination, we're looking at how we can do that.
Right.
So we're looking at food as medicine programs. I was talking to Indira because I met with a group just yesterday that want to start a horticulture therapy program.
Lovely.
Lovely.
That includes, people practicing self-care through taking care of plants and really getting back to nature, but having therapy sessions together as a group, eating healthy and teach each other healthy eating classes. So that's something that we need to do. And I think examining how to bring care into the communities best is something that we're really passionate, into looking into. But I will say during the pandemic, one of the things that I'm really proud of that we did even before I got here, I was talking to, the leadership as I was getting ready to go. I said, are we out in the communities? And so what we did was in partnership with the mayor and also Texas Southern University, TSU. So St. Luke's Health sprung up on campus a vaccine clinic. And we did just that. And not only did we do it in the 3rd Ward at TSU, but we did it over at Rice to take care of those people there too. And then we did it also in Brazos Valley. And so we had
Fantastic.
Fantastic.
We had several. I think at one time we had 6 because we also did it at the Woodlands too in that area. So we did it in North Houston. So we do go out to clinics and take care of people and meet them where they are with their needs. Now, do we need to do more of it? Absolutely.
Right. Yes.
Absolutely.
Right.
Going back
There
to-
is never enough. That's what it is.
Yeah.
Right.
Going back to Indira, I'm obviously on your board. By the way, folks, we're listening to Open Forum. We have our folks from St. Luke's. We love both of y'all. You guys have been amazing.
Oh, thank you.
Indira is on the board. She's been on the board for more than 17 years. And Miss Tiffany has come into St. Luke's about a year ago from other places, Florida, to be exact, Florida and California.
From California, yes, originally, yeah.
And of course, you're the vice president of communications
And marketing.
And marketing. I keep forgetting that word.
Don't forget it. They
No,
never let me
cannot.
forget it.
Yeah, and
It's a lot of
marketing.
work. Yeah.
So on the board, when you all have board meetings, less than half your board members are physicians. And physicians are tough cookies, you know that. Do they listen to the non-physician board members' ideas, or they whisper under their breath something?
No, I think
Are they pretty open to?
they are pretty open. We all bring in different strengths.
Right.
And we actually go through a matrix every year to kind of fill out where are each individual's passion is around.
Okay.
Which is how I kind of got put in the audit and compliance committee.
Okay.
But so they do actually do that. And it's interesting because sometimes it's actually interesting to see physicians wanting to talk more about the business than
Yes.
the clinical aspect of it as well. So it's interesting to see those
Wow.
things.
And vice versa,
Wow.
maybe, because
Yeah.
Really?
Yeah.
your focus maybe, look, we have to have the patient as the bottom line, not the
Right.
bottom line as the bottom line. So it's very interesting to have a mixed board out there, and it's amazing that both of y'all could come out here on a Saturday evening. You could have been playing golf in the rain out here, Tiffany, but you chose not to.
Or maybe...
And Indira maybe, planting some new flowers, but she said, no, I'm not going to do that today. I'm going to be coming out here and talking to us. And I want to really take this opportunity on behalf of Jagat. Smriti is not here. She's our co-host. Smriti is getting married.
Oh,
so when
congratulations.
Yeah, I know, right? So just before she's getting married, she's got this excuse of, I'm getting married. I'm not coming today. I'm like, Smriti, hold on. What do you mean? What do you mean? We need you.
I'm sure she's listening.
I don't care if she's listening. I want her to listen to us.
I want her to listen.
Yeah, she needs to know. We need her here. But again, and Jagdeep Ahluwalia, of course, he's been a stellar citizen in this county, in this town out here, and done a great job. And Jagat would vouch for that because Jagat and I have known him for a long, long time. Thank you, Jagdeep, for doing this. Great stuff. IACCGH, they just announced that September they're going to have the gala.
Right.
And you've got to go on the website. And we do have two programs coming up. Let me see, what are they? Okay, let's see.
Oh, it's a big
do you
list.
have them there?
It's a big list.
Come
here.
on, read it out, buddy. Okay, on May 3rd evening, it's going to be Dr. Aparna Kamath in conversation with Malisha Patel, who's
Right.
the CEO of Memorial Sugarland and Memorial Southwest. The event is going to be co-chaired by IACCGH board members Malisha Patel and Joya Shukla, who's the past president. Right. And on May 19th, there's going to be a Shell Distinguished Lecture featuring Lorenzo Simonelli, CEO of Baker Hughes. And but the best thing is you've got to go on their website. Let's see, where the heck is that website gone? Do you have it there with you? It is IACCGH.com. It's very easy. And he's got so many other programs coming up. And folks out there, if you want to become members of IACCGH,
They should become a member.
should. I'll tell you, a lot of people who listen to us, then they'll call me and say, how can I become a member? Look, if you're listening, IACCGH.com. My phone is not for free. You call me, I'm going to charge you next time if you ask me how to become a member. And I want to thank both of you. Indira, I want to really thank you for coming. You and I have been friends for a long, long time, but this is great that I can interview you, and then later on she's going to shout at me. I'm like, you know what? Subodh, what do you do? She won't do that. And Tiffany, thank you so much for coming out here.
You're absolutely
Come back
welcome.
again, both.
Well, she is already booked for the next week, next month.
I will say one thing, though. It's really thanks to Jagdeep. I have a really hard time saying no to Jagdeep when he asks me to do this, and he was like, can you do this today? And I was like, yes.
I can do it.
So,
Yes.
yes.
I know.
Anything for
It is
Jagdeep.
difficult to say no to him, right?
I know.
Yeah.
But come back and tell us about Mr. Sarma. How's he doing?
He's doing good.
He's doing good.
yes.
I hope he's listening to you.
I don't know if I shared all the information with
You
him.
did not.
Yeah.
All I want to tell him is she's going to be coming home, make that food that you promised you're going to make today.
Oh, my goodness.
Does he cook at all?
No, if he can just fold the laundry, I'll be happy.
Well, then let him just boil. Just boil the water.
Yes.
Yeah. All right. Again, thank you. Last few seconds, if you want to say anything about St. Luke's, it's your floor.
Right.
Both of you, one
just
by
go
one.
ahead. Anything that we missed and you want to cover.
Yeah.
I just want people to go to their PCP. I really want people to go. Our website is fantastic. It has a lot of information. We've got a new, I affectionately call it, he's going to kill me. I affectionately call it the new Doug Hub.
Oh.
Yeah, it's our CEO. We've got Ask Dr. Doug Lawson at our website, and we've got a new format for our Find a Doc.
Okay.
I think those are really big deals. If you do not have a primary care physician, go to our website, click on Find a Doc. You'll get ratings, you'll get reviews on there, and you'll find a doctor near you. I think that's the greatest thing that I want to emphasize. And also, I want to say hello to Dr. Conneru. Because she is my doctor, she is my PCP.
Is she listening?
And I don't know.
Yeah.
But she will hear it because we are recording this.
Oh yeah.
Yes.
Oh my God.
And I want to make sure
I should have
that.
been on my best behavior then.
And I want to make sure that people know that she's a great doctor, and I will be seeing her soon because I practice what I preach, and I go see my PCP. So
Super.
Yeah.
How about you, Indira?
I do want to say, I think everyone should go online and look up Hello Human Kindness.
Absolutely.
Okay.
If nothing else,
Hello,
it just
human kindness.
yeah,
Hello,
it just puts a
humankind,
smile
huh?
on your face. Those videos, I really think
So tell us, what does Hello Humankind talks about?
You could probably take that.
All right.
Yeah. Well, Hello Human Kindness is actually how we express the care that we give.
Okay.
Because if you don't do it with the backdrop of Hello Human Kindness, expressing yourself through kindness. And what that means is making sure that we practice care with cultural competence. I think we talked about that before. Understanding what your patient's needs are within the community. And, we talked briefly about how maybe communities of color need to look at their relationship with maybe therapists a little differently than we did a couple of generations ago. It's not just what happens in the house stays in the house. You need to actually go talk to somebody and open up. And I know that communities of color don't. So I think it's providing high quality care, cultural competence, but really doing it on the foundation of kindness, because at the end of the day, that's what it's all about.
Are you talking about mental health when you're talking about this?
Well, not just Hello Human Kindness is providing care with kindness and showing and doing acts of kindness, period. And when you take care of people and you heal, that's the ultimate act of, of human kindness.
You've said it's a very profound thing that y'all have started. A hospital, the way the hospital runs is how you treat a patient. 50% of treating 50% of treating any patient is the human contact, whether it's the janitor who comes to clean the room in the morning, or the PCA who's taking the temperature of that patient, how she approaches that patient, or whether it's the nurse who's starting that IV, or the phlebotomist who comes 4 in the morning to wake someone else. How does she do it? With the kindness that she uses. Or the physician and the specialist who come out there, or the CEO.
Only the patient cannot go to
the board member. I mean, each one has a role to play. And that, when you put that role together, is the human kindness we're thinking of. 50% of treating a patient is how do you talk to the patient.
I think it might,
and that's all it is.
Well, not only that, the patient also needs to open up. I think particularly when it comes to the mental health and a lot of other diseases, that the patient and the families are keeping it so quiet and secret, within themselves. And I think we need to do a show particularly on mental health.
We sure will.
And invite some of the experts here, and because there is a taboo to talk about mental health, whether it's a minority community, our community, or any community for that matter. When it comes to mental health, all of a sudden, no, we cannot talk about it. And I think people need to be more open about it.
Sounds good. Listen, all good things don't necessarily come to an end, but we put a full stop or a comma maybe. So I'm going to put a comma out here today and invite y'all to come back again, and so we can start this conversation all over again and much more than we've done today. And so, Indira, thank you so much for taking time. And Miss Tiffany, ma'am. Thank you so much. And I want to thank our cameraman out here, Darshak, who's doing a live on Facebook today. Thank you, Darshak, for coming out.
45 90 minutes, man.
And then we have a second cameraman out here, and you're going to help me. Brad?
Yeah.
Oh, thank you, Brad, for coming out here. We really appreciate you coming and doing this. I could never do this. That's why I do this. Thank you. We're going to take a short break out here, folks. We're going to come back to Open Forum. Thank you, Indo-American Chamber of Commerce of Greater Houston. Our number is 1-888-749-1035. The reason I'm giving the number is when the guests leave, then they start asking us the question. I'm like, the guests have already gone. Why are you asking me this question now? So let's take a little break out here and come right back in the conversation.
Absolutely.
Open Forum 103.5 FM.